Hello everyone, this is Katie Barrett and this is my presentation on autism. I found this quote that states, "Some people with autism may never be able to speak or answer to their name, but they can still hear your words and feel your kindness." I felt like this quote was great and it culminates how people with autism may feel, because even though they can understand what you're hearing, they can't always express how they feel. So please be mindful of the things that we say around people who have autism. What is autism? Autism spectrum disorder, or ASD, is a developmental disability that can cause significant social, communication, and behavioral challenges. The etiology. It is a disorganized arrangement of cells in the prefrontal and temporal cortex that begins before birth. Low levels of vasopressin, abnormal communication in cerebral areas, abnormal shape of the caudate and putamen, and larger than normal amygdala in childhood but not in adulthood. Low levels of vasopressin are associated with social impairments. Abnormal shape impairs motor, social, and communication skills. Sensory overresponsiveness due to abnormal strong activation on sensory corticals and amygdala. Genetic and environmental factors. A study that I found states that exposure during pregnancy to drugs used for treating asthma or allergies, which is B2AR agnostics, is associated with a modest risk, increased risk for ASD. Environmental exposures during pregnancy, such as pesticides and air pollution. Diseases during pregnancy, such as gestational diabetes mellitus. Drugs such as valproic acid and thalidomide. Dietary factors such as folic acid deficiency can influence fetal brain development and increase risk for ASD. Other factors include advanced prenatal age, extreme premature birth, and short interpregnancy interval. The estimated prevalence in 2018, the CDC determined that approximately 1 in 59 children are diagnosed with autism spectrum disorder, 1 in 37 boys, and 1 in 151 girls. Boys are 4 times more likely to be diagnosed than girls. Most children were being diagnosed after the age of 4, although autism can be reliably diagnosed as early as age 2. 31% of children with ASD have intellectual disabilities, which is an IQ less of 70. 25% are in the borderline range, which is an IQ of 71 to 85. And 44% have IQ scores in the average to above average range, which is greater than 85. Autism affects all ethnic and socioeconomic groups, and minority groups tend to be diagnosed later and less often. So as you can see in this map, just in the past 12 years or so, autism has grown substantially, which is very scary. And I personally feel like this is due to just an increase in awareness, but I also think that it could be overdiagnosed at times. So progression. First signs are shown during infancy or childhood. Progression varies greatly between individuals. Limitations in communication symptoms can become less severe later in childhood. Some adults do show improvements, but others decline. If the child has above average intelligence, they are shown to have the most improvement over time. Other areas that do not improve are the repetitive behavior, rocking, spinning themselves or objects, and obsession with order and routine. Common signs and symptoms. I found this great YouTube video that I would like to share.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the way I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
So I felt like that was a good depiction of what autism can look like. So learning the signs and symptoms, as stated, as early as possible is huge. Some other signs and symptoms can be an absent head tilt reflex under a year of age. So if you tilt an infant laterally for 3 to 5 seconds and their head does not turn upright, this is a sign of this reflex not being there. Abnormal head circumference, poor eye contact, and decreased shared attention, which is responding to nonverbal cues, pointing, or eye movements towards an object. Problems with social, emotional, and communication skills. Repeat certain behaviors and might not want change in their daily activities. They have different ways of learning, paying attention, or reacting to things. They don't notice obvious objects in their environment. They have difficulty relating to others' feelings and talking about their own feelings. They don't like to be touched, or they will only touch on their own terms. And they may be unaware when people talk to them, but they respond to other sounds. Risk factors include environmental, biological, and genetic factors. Genetic and hereditary factors are more likely to develop ASD. So if their parents have ASD or their siblings have ASD, there's 83% more likely to develop. ASD occurs more with certain genetic or chromosomal conditions such as Fragile X and tuberous sclerosis. When taking during pregnancy, prescription drugs such as valproic acid and thalidomide can increase the risk. There is some evidence that there is a critical period before developed ASD occurs before, during, and immediately after birth. Children who are born to older adults and maternal infection, low birth weight, and multiple births are other risk factors. So our OT evaluation. Our OT evaluation will start with an OT profile to kind of get an idea of where the person is at. Any kind of background information would be great. There are evaluations out there that OTs perform. One includes a sensory integration and praxis test. You have to be certified to be able to perform this test. It's an extra certification that you have to go through, but OTs can perform this after being certified. The sensory profile, there's a caregiver questionnaire, a school companion, and an adolescent adult profile that you can perform. The sensory processing measure, a sensory experience questionnaire, the developmental test of visual motor integration, and the COPM, that would give you a really good picture of where your client is at and where to go with your outcomes and interventions. So the areas of occupation that are affected are pretty much all areas of their life. Work is affected, so obviously picking work might be hard, and then also participating in work tasks could be very difficult for people with ASD. Education, participating in academic, non-academic, extracurricular, and vocational activities are difficult. Leisure exploration and participation skills. Social participation within their community, family, and peers and friends. They could be hyposensitive and sensory seeking, which is significantly negatively associated with social adaptive skills. Play exploration and participation, ADLs such as bathing, showering, toilet hygiene, dressing, feeding, functional mobility, personal hygiene, and grooming. IADLs, including communication management, health management, and maintenance, meal prep and cleanup, safety and emergency maintenance, and shopping skills. And rest and sleep is a big one. People who have ASD have a hard time falling asleep and staying asleep for long periods. So the models that I choose, the first model I chose was the ecology of human performance. It focuses on the general task performance and allows practitioners of various disciplines to consider ADLs, work and productive activities, education, leisure, play, and social participation. As stated, all of these areas are affected in people with ASD. OTs can help to establish, restore skills and abilities, alter the context in which the person performs these skills, modify and adapt the task so it can be performed, prevent the occurrence of poor performance, and create circumstances which promote health. Person, environment, occupation emphasizes the importance of considering context, particularly authentic context. So children's naturally occurring environments, which is most of the time their home or their school or outside on the playground, when addressing participation in context may also be highly variable. The MOHO, which is an evidence-based conceptual practice model that explains how people adapt to severe disability and live a meaningful life. Occupations are motivated, patterned, and performed, and offers a broad and integrative view of human occupation. This includes the child's participation level and identifies barriers from birth to the age of 21 years old. It includes client-centered and occupation-focused principles of the human occupation theory and further demonstrates the patient's patterns of strengths and weaknesses in occupational performance and can be used to design appropriate intervention programs. So I felt like all of these models cover a lot of the areas that we discussed that people with autism are impacted in their lives. So the frames of references that I chose include the sensory integration frame, where you find activities that involve the type and intensity of sensation the client needs to normalize sensory processing and produce adaptive responses. Their inner drive of the client will continue to spiral upward toward increasing maturity. They desire to engage in functional activities will increase. The lifespan development frame, which addresses an individual during a transitional period throughout their lifespan. It assists with adaptation to changing roles, such as identity issues in adolescence or retirement later in life. Establishing and restoring client-chosen age-appropriate occupations within continued life roles, and in helping clients to adapt to changes brought on by health conditions within and across the lifespan developmental continuum. The applied behavior frame, OTs can help to facilitate desired behaviors by defining goals and working toward them using skilled instruction, modeling, coaching, and behavioral reinforcement. And finally, the cognitive behavioral approach, when psychological barriers to activity engagement are encountered. It's used in behavioral medicine because it is especially effective in dealing with motivation and emotion. So in OT, cognition and emotion is the focus of the evaluation and intervention. So OT interventions include sensory integration. This is finding the just right challenge in all senses, including auditory, tactile, visual, gustatory, vestibular, oral, and proprioceptive activities. Neuroscientists define SI as the brain's ability to organize sensory information received from the body and environment and produce an adaptive response. Exercises are a good intervention, including yoga exercises, brain gym exercises, and obstacle courses. This can help to calm, organize students who are having difficulties focusing and attending to their tasks. So if you don't know what brain gym is, I will just briefly describe. It is a variety of positions that you put yourself into. So it's kind of similarly like yoga, but it's specific movements that theoretically get the brain to talk to both sides of the brain. So as an example, you would ask the child or the student or the adult to place one hand right underneath their collarbone and the other hand right on top of their belly button, and you would hold this position for about 5 to 10 seconds, and then you